The clock is ticking if you plan to buy a health insurance plan, and dragging your feet, that could mean paying extra.
Colorado's brand new reinsurance program could help you save money, but to get a good deal, you're going to need to shop around for a plan.
Denver 7's Megan Lopez explains why.
Remember that roadmap to healthcare Governor Polis laid out back in April? Well, reinsurance was a big part of that. See? Right there, step number 2. This open enrollment will be the first big chance for people to see their legislature's work in action. But first, a quick refresher on reinsurance. This is Rachel Wall.
Okay, this is done.
A professional baker, and
I was born with a genetic disease, really rare disease that causes episodes of mass swelling.
someone insurance companies consider a costly client.
My whole life has been a struggle to access health care.
Reinsurance will use federal money to help cover some of the most expensive patients.
It essentially insures the insurance companies.
So people like Rachel will not only be able to buy insurance like everyone else, but their health care costs won't raise yours.
So I'm hopeful that it will affect me in the long run.
So that's reinsurance in a nutshell. Back to your premiums this year. And for that, we're going to use this bag of M&Ms to help me explain what's different this year. So these M&Ms are people who buy an insurance plan without the help of their job and who pay for it on their own. Thanks to that reinsurance program, your premiums are going to go down by about 20% this year. So these M&Ms are people who buy an insurance plan but who are lower or middle income and maybe need a little bit of help paying for it. That's about 77% of people in the individual market. Now the government gives them a subsidy to help them pay for their health care. Because of the reinsurance program, their premiums are going to go down, yes, but so is that government subsidy, meaning that you might end up paying just a little bit more. Now you're probably thinking, wait a minute, that's exactly the opposite of what you just said the reinsurance program is supposed to do. Well, here's what Connect for Health Colorado wants you to know about that.
They actually can still see savings as long as they maybe shop around a little bit.
Even if your premiums go up, though, the group says you still might be getting more bang for your buck.
Really looking beyond just that monthly premium, maybe looking at the copays, how frequently you use care.
But the bottom line is you need to do your homework and shop around. And don't assume that the plan that you have now is the best one that's out there for you. Megan Lopez, Denver 7.